buddy,
Yes, Kanika.
do you know something?
About what?
Recently, I heard about the breast cancer in male.
Oh,
Is
okay.
it true?
Yeah, it's true.
Can you explain about that?
Yes, of course, can. Okay, guys, I would like to share with you too. So let's see. Before we're going to the breast cancer in man, we must know what is cancer. So cancer is ungrowth cell in our body which can become a tumor. So type got 6 type, which is carcinomatosis, sarcoidosis, leukemias, lipomas, myeloma, brain and spinal cord tumor. So now we looking to the breast cancer in men. So breast cancer in men is ungrowth cell in breast. So usually the woman only get the cancer in breast, but actually it's wrong. Men too can get the breast cancer, but it's rare. Only 1% in the world can get. For the epidemiology, I mentioned before, it's a rare cases. Only 1% of population men can get. So for the each year, 0.5 to 1.0 per 100,000 men only can get. So it's a diagnosis usually 60 to 70 years old, and then we're looking for the risk factor and awareness, but these two I will mention the main things only, because later on my friend will explain more detail lah. So for the awareness, it will be self exam and the regular scanning and begin inform about the symptom. For the risk factor, got age, genetic and family history. So that's all for me.
So before this, my friend Durga is already tell about the risk factors. So now I'm going to tell about risk factors in detail. So breast cancer is so rare, but a serious condition in men. So the risk factors. So firstly, anemia. Anemia means is the natural growing and older characteristic by physically, biologically and psychologically changes over time. Is risk increased with age of 67. And secondly, genetic mutation. Genetic mutation got two type, is BRCA1 and BRCA2, is heightened risk. Third, family history. Maybe your family members got previously got ovarian cancer or breast cancer. And hormonal imbalances. Hormonal imbalances increase estrogen level and can contribute the hormone. Fourth one is radiation exposure. Previously, chest radiation increased risk in the main of the risk factors. And last one, lifestyle factors. It's for example, obesity and alcoholic person. It can be effective the breast cancer in male.
Hi, I'm Rikushri Aparapan Maran, batch 27A. I'm talking about symptom and diagnosis. Common symptoms: lump, a painless or painful lump in the breast or underarm. Nipple discharge, usually discharge, possibly bloody or clean. Pain perception, breast pain or tenderness. The skin changes, redness, dimpling, or thickness of breast skin. Diagnosis methods: clinical examination. Doctor checks for lumps, skin changes, or nipple issues. Mammographic X-ray imaging to detect abnormalities. Ultrasound uses sound waves to differentiate solid masses from acid. Biopsies Tissue example taken for lab analysis to confirm cancer. Genetic test identify inheritable mutation, example BRCA1, BRCA2.
Hi, my name is Lavanya Sri. My ID number is DSC 08222000008. Male breast cancer progresses through different stages classified using the TNM tumor node metastasis system. Stage 0 carcinoma in situ is the earliest and most curable stage where cancer cells remain confined within the ducts or lobules without invading surrounding tissues. Stage 1 early stage cancer involves a tumor up to 2 cm in diameter with no lymph node involvement or metastasis, offering a high survival probability with prompt treatment. Stage 2 localized cancer fetus tumors between 2 and 5 cm, potentially affecting nearby lymph nodes but no distant organs and is typically treated with surgery and radiation. Stage 3 regional extent involves tumors larger than 5 cm, with cancer spreading to multiple lymph tissues, lymph nodes, the skin, or the chest wall, requiring extensive treatment like chemotherapy and surgery. Stage 4 metastasis breast cancer is the most advanced stage where cancer spreads to distant organs such as the brain, liver, lungs, or bones, necessitating systematic treatments like targeted therapy and palliative care. There are several types of male breast cancer. Invasive ductal carcinoma (IDC) is the most common, beginning in the milk ducts before spreading to surrounding tissues. Ductal carcinoma in situ (DCIS) is a non-invasive early-stage cancer that remains confined within the ducts and has a good prognosis if detected and removed. Lobular carcinoma, thought rare in men due to fewer lobules can spread widely and is often difficult to detect. Inflammatory breast cancer (IBC) is an aggressive and uncommon form that leads to redness, swelling, and warmth due to clogged lymph vessels, often misdiagnosed as an infection. Page disease of the nipple starts in the ducts and extends to the nipple and areola, causing symptoms like crusting, redness, and irritation, and is frequently associated with underlying malignant growths. Early detection is crucial in improving treatment success and survival rates. Treatment options include surgery, radiation, chemotherapy, hormone therapy, and targeted therapies. Increased awareness, research, and education play vital roles in ensuring early intervention and better patient outcome.
The next is treatment option. Breast cancer in men is rare but can treated effectively, but if the cancer detected early. Treatment option depends on the factors such as cancer, stage, or overall health. Here are the main treatment options for the breast. So the first one is surgery. Surgery is the most common surgical treatment approached by the doctor to the patient who has the breast cancer. Not only for the woman, the men's too. This surgical treatment is called as mastectomy. It's including involves the removal of the entire breast tissues and also the nipple too. So if the cancer has spread, the lymph nodes may be removed for the prevent future spread. The second one is radiation therapy. Radiation therapy often used after surgery to destroy any remaining cancer cells and reduce the risk of the recurrence. The third one is hormone therapy. Hormone therapy, most male breast cancers are hormone receptor positive, meaning they grow in response to estrogen or testosterone levels. The fourth one is chemotherapy, used when cancer is aggressive, as pre or after surgery to reduce recurrence risk. Involves drug. Mostly chemo is suggested by the doctor to the patients that who has the cancers. With any cancers can treated with the chemo. For example, that can be a breast cancer, that can be a hepatitis, it can be liver cancer. So any cancers in the world can treated by the chemo. With the chemotherapy, the patient can be reduce the developing cancer cells. The last one of the treatment option is targeted therapy. If the cancer is HER2 positive, drugs like Herceptin and pertuzumab may be used to target HER2 proteins. So that's it from me. The treatment options for
Prognosis and survival rates. Facts affecting prognosis. Early stage cancer have better outcome. Tumor grades, higher grades means more aggressive cancer. Repetition status, hormone repeated positive cancer respond better to target therapies. Example PR, HER2 status. Survival rates compared to female breast cancer, male breast cancer lower survival rates due to later diagnosis. Female breast cancer higher survival rates with early detection and broader awareness. Thank you.
A major challenge in combating male breast cancer is the lack of awareness, which often leads to delayed diagnosis. Many men do not realize they can develop breast cancer, making it crucial to educate the public on symptoms such as lumps in the breast, nipple discharge, and changes in breast tissue. Awareness campaigns, media outreach, and community initiatives can help inform men about the importance of self-examination and routine medical screenings for early detection. However, stigma remains a significant barrier as men may hesitate to seek medical help due to embarrassment or social misconception. To address this, public awareness campaign and support groups should work to normalize discussion around male breast cancer, while healthcare professionals must emphasize that early detection saves lives. Governments and healthcare institutions should also ensure equal access to treatment and allocate sufficient research funding to improve patient outcomes. In conclusion, male breast cancer is a preventable and treatable condition when addressed early through public education, increased screenings, and the promotion of healthy lifestyle. The incidence and severity of this disease can be reduced. Empowering men to take charge of their health will not only improve survival rates but also foster a more supportive and informed society. Increased research and expanded treatment options will further enhance patient outcomes, ultimately saving more lives.
So, challenges in diagnosis of breast cancer in male. First one is delay diagnosis. Low awareness lead to late stage detection and misconception. Usually, men were thinking about the breast cancer only for the woman. It's a selfish thing. The man also got the affect the disease of the breast. So the second one is increasing awareness and participation. Public awareness campaign. It's like we can have a campaign for the men who have got the thinking about the only effect for women, so they can know about the breast cancer not only for the woman or the man too. They affect the breast cancer. And second is encouraging clinical trial. So the encouraging clinical trial is mostly have a effective treatment in non-specific to the men. So the next one is psychologically and emotional challenges. Stigma. Male breast cancer carries social stigma. It's also complicating patient experience. It's to male. Lack of support. Need for talented support groups for the male patients, for the breast cancer patients.
Male breast cancer is a serious but often overlooked health issue caused by environment factors, hormone imbalance, or genetic mutations. Men with BRCA1 or BRCA2 gene mutation are at a higher risk, along with those who have a family history of breast cancer, obesity, heavy alcohol consumption, liver disorders, prolonged estrogen exposure, or a history of radiation therapy in the chest area. Prevention strategies focus on maintaining a healthy lifestyle, including a balanced diet rich in fruits, vegetables, and lean proteins. Regular exercise to manage weight and avoiding alcohol and tobacco use. Men at high genetic risk should consider genetic counseling and routine medical checkups, while limiting exposure to harmful chemicals and environmental toxic can further reduce the likelihood of developing breast cancer.